Hi, I'm Susan Shaner with Sage Leadership Strategies, and I'm your host today of Community Forum. And I have with me Dr. David Johnston, who is a doctor of osteopathic medicine, and he's here to talk to us about things you can do to take more responsibility for your health. Welcome.
Hi, Susan. Thanks for having me.
Thanks for coming on the show. So, first of all, tell our viewers, what is osteopathic medicine?
Well, osteopathy is it's a gentle form of a hands-on treatment practiced by certain doctors of osteopathic medicine. And the goal of it is to open up the circulation, balance the joints, the muscles, the flow of the cerebrospinal fluid and the nervous system, and things like that.
So when you say hands-on, does that mean you're working on people's necks, or it could be their arms or their legs or
It's
their
a
back?
whole body treatment.
Okay. Is it like a chiropractor?
It's different than chiropractic. Chiropractic tends to focus more on just the spinal alignment, whereas osteopathy, you're a complete physician. You go to medical school for 4 years, you work in the hospital, deliver babies, assist in surgery. You have a full practice of medicine and surgery. You can prescribe medicines, do x-rays, like an MD.
Okay.
But the more holistic, traditional part of osteopathy involves kind of looking at the structure and the function of the person. So you'd look at their spine, their muscles, their joints. They'd give a history, and then you would do a hands-on treatment.
You know what, I remember years ago my brother was in a car accident and he had a really bad whiplash. And this was a long time ago. It was probably like 20 years ago. Like now some people have heard about doctors of osteopathic medicine. Back then, it wasn't that well known. And they suggested that he go to an osteopath because between the orthopedic, between the chiropractor, and they were talking about the meningeal system. Can you kind of speak to all this?
Absolutely, yeah. That's a really common injury that we see a lot of. And that's where the technique called cranial osteopathy comes in. Some people know it as cranial sacral, but it's a specific treatment for the meningeal dura, the covering around the spinal column, the bones of the skull, like the occiput, the base of the skull, the neck, and then all the way down to the sacrum.
So it's a combination of the bones and the muscles and
the spinal fluid flow, and the meningeal dura. So for instance, like in a whiplash injury, if there's like a hyperextension of the neck, what happens a lot of times is there's pain in the neck and the head, there's headache, and there's inflammation there. But the initial injury is actually in the sacrum and the tailbone because it hyperextends the neck and puts a pull on the dura or on the spinal column.
Okay.
So with
I don't know all the terms.
All right. So what that means
the neck and the spine
is you put a pull on the neck, it puts a pull lower down in the tailbone, and then the primary lesion has to be treated from the tailbone. So we do like a hands-on technique to release the strain in the tailbone, and then the flow releases all the way up to the base of the neck, and that will relieve the symptoms a lot of times. You'll get relief.
So obviously you decided to become a doctor. How did you decide to go into this particular line? Like, how did you learn about it? Because did you know about osteopathy when you were little?
No, I got some chiropractic treatments when I was a teenager, just with some neck and back pain. And then I was interested in, I kind of knew I wanted to be a doctor at a young age.
You like the sciences and all that?
I like the sciences, I like biology. I studied pre-med in college. And then working in the hospital, in the emergency room, I kind of got interested in, the human dynamic of working with medicine. Saw my dad have a bypass surgery at an early age.
You saw it?
Well, I saw him go through the after effects,
Oh, okay. You didn't actually see the surgery.
Right. I was in 8th grade. He had an open heart. He had open heart surgery, and then I saw him in recovery.
Yeah.
With the tube down his throat, and I was just like, "There's got to be a better way to prevent this."
Yeah, that's heavy duty.
Yeah. So then I started to become interested in nutrition and prevention and exercise and things you could do to keep yourself healthy.
To prevent that kind of episode.
To prevent those kinds of things and, more minor things. And then as I was applying to schools, I looked into chiropractic, I looked into medical school, and, osteopathy seemed to be the best of both worlds. You could be a physician, yet you could learn to kind of work on the body on a different level, work with nutrition. Osteopaths work with different modalities. Some of us will be more traditional osteopaths and do like a hands-on treatment exclusively like I do. Others will combine acupuncture or acupressure. There's many different modalities in the world of hands-on medicine.
Now, you also deal with nutrition?
I do.
Because most doctors, I think they have like one night of one course or something in nutrition.
I
Most
learned
doctors
about 10 hours in medical
most
school.
doctors don't know anything about nutrition.
Exactly.
So what's been your training in nutrition?
I was lucky enough to get exposed to nutrition in my residency when I was moonlighting with another osteopathic doctor. And she had trained under Dr. Schachter, who was one of the first holistic MDs up in Rockland County.
Oh, really?
So I learned a lot of things about nutrition, intravenous therapies, how to use vitamins and nutraceuticals to bring the body back towards health.
And diet?
And diet and detoxification and really looking at the whole system, you know, seeing what people need in their system.
So how is it different than like a naturopath who does a lot with nutrition and supplements?
Right. Well, we're not trained formally in like nutritional therapy. You know, these are courses that doctors can take.
Yeah.
Like the Institute for Functional Medicine, a lot of the good nutritional companies out there, like Zymogen, Metagenics, will offer training to their doctors too, because they want you to understand how to prescribe the supplements.
Oh yeah, sure.
And then I just did a lot of study and listening on my own, reading. I mean, there's tons of information.
Right.
My first board certification I took in the year 2000 with the American Board of Holistic Medicine, and a good portion of the exam was on nutrition and functional medicine and how to combine that with getting to bring people back towards health.
So does that then give you a certificate in nutrition, or what in passing that board, what do you got?
Yes, to some degree, depending
Okay.
on if you take that certification. It's like a 6-day course. They'll give you a certificate at the end of the training. So yeah, I would consider myself trained in functional nutritional medicine as well.
So what does that mean, functional nutrition?
Functional nutritional medicine
versus dysfunctional? I don't know what that
Right,
means.
exactly.
Right.
It's just a term that refers to looking at the whole person. So you
Okay.
might look at their blood work, you might look at, you know, diagnosis of food allergies,
Okay.
heavy metals, things that might be interfering with their system. You'll sit down and do a detailed history of their diet, their lifestyle, their stressors.
So do you incorporate some of that into your practice?
Absolutely. Incorporate that into every treatment.
So
On the first evaluation,
Yeah.
you sit down with patients for about an hour or so.
So your core is osteopathic medicine, but then you
Correct.
incorporate nutrition. What else do you incorporate?
Mostly those things. Education about exercises,
Yep.
stretching. I like to teach people about how to do relaxation and meditation type techniques.
Yep.
Things to kind of keep themselves grounded and to reduce stress. Definitely important in today's world.
Oh yeah, that's wacky
Yeah.
out there. How would your average patient, or I guess what we might call today healthcare consumer, right, know when to employ what healing methods based upon? I'm sure you probably see people with an array of conditions that are maybe emotionally based, physically based, maybe spiritually based.
Absolutely.
So, can you speak to that a little
Absolutely, yeah. I mean, osteopathy is really unique in that it kind of addresses the whole person, but it really kind of starts from the nervous system. So if you can kind of balance someone's fight or flight stress response
Yeah.
by doing the cranial technique and getting their nervous system more relaxed, that's going to help the circulation, it's going to help reduce pain, and then any of the hands-on techniques, the body's going to integrate them much better.
So when you say cranial sacral, so it's a lot of just like this spot, like where your spine connects to the back of your head, that
Yeah.
soft spot.
There's like
kind of in there.
at the base of the skull, kind of about, like right in back there.
Yep.
It's a very important area to kind of treat and release. There's a lot that goes on there. The spinal column exits the skull there. There are the cranial nerves there. So there's a tendency for a lot of inflammation to
Oh,
occur
really?
there.
Just you mean from tension or
Yeah,
just?
from tension, from postural strain,
Yeah.
from the nerves being irritated, from old injuries like a
Yeah.
whiplash
Yeah.
or old
Do you
falls.
see? Yeah, unfortunately have had more than my share of whiplashes, I will say. And you know, knock on wood. There's no wood in here. Knock on wood. Where's the wood? You know, I'm fine, but I also do yoga and meditation to try to.
It's very important to help
But I'm wondering also, with all the people that are at their computers all day, either hunched over or just staring at the screen, do you find a lot of injuries or strain connected to that?
Yeah, we see like there's a lot of repetitive strain injuries, whether it's carpal tunnel, neck pain, shoulder pain, upper back pain. And a lot of it is postural. People don't always have the best ergonomics. Workstation,
so
proper
that's kind of
posture and stuff like that.
Yeah, that's a good preventative thing. But are there any, can you just give us like one exercise that could be a good stretch or something to do for somebody who's maybe not sitting correctly or just at the computer all day long? What can they do?
I mean, demonstrate it for you? Yeah, I mean, there's a really good technique where you kind of just shrug your shoulders up and roll them back.
Yeah.
It's just a shoulder roll.
Yep.
They say for every hour you're sitting, you should get up and stretch for at least 5 to 10 minutes. Not always ideal to do, but...
Not everybody does that, but even if it's just 5 minutes, it can make a difference.
It can make a huge difference. Another good one, if you want to just kind of stretch the neck, is kind of to pull the arm back like this, and then just kind of bring the head forward. So you're pulling the arm back this way. It's hard to see it from...
So back, you're pulling it back?
Right, so I'm pulling my left wrist towards my right hip, and I'm also stretching my neck like that.
Oh, okay, so you're pulling this this way, kind of in the back. So I'm pulling on my
right, you're pulling your left wrist
this way. Okay.
And then you bring your neck kind of to the right and forward.
Okay, so yeah, you're just getting a really good stretch.
You get a good stretch to the neck muscle.
Yeah.
I mean, depends on what...
And then do it the other way.
Another good one, simple, is just to kind of open up your shoulder blades, pinch them together for 5 seconds, release, and do that a couple of times.
Yeah, I feel like I'm at the gym.
Yeah, because we tend to kind of roll forward. Everything kind of posturally gets pulled forward and down by gravity.
Yep.
So those are just some basic things that you can do.
So that would be part of your recommendation treatment for somebody, in addition to maybe manipulate, I guess that's a chiropractic term, right? Like manipulating?
No, it's osteopathic manipulation, sure.
In addition to doing that, you might give them some exercises to do.
Absolutely.
And so can you speak to also what you encounter in your practice in terms of people taking responsibility for their own health? Because it's easy for people to, I don't know, blame the office or blame this and that. But like these exercises, that's something that they are empowered to do, and they just need to set aside the time to do.
Well, what's unique, interesting about the treatment is it stimulates more of a feeling of health in the body. The osteopathic treatment really does take the health that's present in the body and augment it or amplify it, so that people, after a couple of treatments, they start to feel healthier. They have better energy, and they have more of an awareness of their body. And then with that awareness comes the realization that they need to take more of an active part in keeping themselves healthy.
And what they can do to stay in that place.
And the stretches are really important. I'll teach them a lot of core-type stretches. Most people have very weak core muscles. Those are the muscles in front of the abdomen, in front of the hips and the lumbar spine. And when you work those muscles, when you learn correct posture, and more importantly, relaxation-type techniques, your whole body starts to shift. I think yoga is great. Yoga and meditation are probably two of the best things you could do to keep yourself healthy.
Saved me. I mean, I'm a reformed overachiever, but I say that.
Me too.
So what would be like one stress management technique you would give somebody who's like off the charts type A?
It would be a simple breathing technique. I'd have them just sit with their feet on the floor, and what I'm going to do is I'm going to breathe. I'm going to put my tongue right at the top of my mouth behind my 2 front teeth, and I'm going to breathe in through my nose for 2 seconds, and I'm going to exhale through my mouth for 4 seconds. And I'll do that for about 5 times. So it looks like this. So what you're essentially doing after you do that for a couple of repetitions, 10 is the most ideal. But if you have 5, if you do 5, you've already started to change the nervous system. You're changing the circulation through the diaphragm. You're shifting energy through your 3rd chakra and your solar plexus. Bringing more oxygen into the body.
Now, when you've talked about working with their nervous system to kind of break the fight or flight cycle.
Right.
One of the things that comes to mind, obviously I'm not a doctor, but the one thing that comes to my mind was working with the adrenals.
Absolutely.
What do you do in terms of working with the adrenals where that all kind of gets concentrated?
Right.
Do you also use supplements to try to
I do.
nourish the adrenals?
Sometimes we'll do some blood work to see, check the markers of the adrenal stress. Most people suffer from some type of like fatigue of the adrenals.
Probably these days, more than ever, right?
Everybody has it.
Yeah.
And that can be connected to fibromyalgia,
Okay.
chronic fatigue syndrome, so it's good to catch that early,
Okay.
along with the thyroid being underactive. So yeah, the treatment will help to strengthen the adrenals and the thyroid and the endocrine system as well.
Okay.
Because when you
No, go ahead.
when you're working on like, when you're doing the cranial techniques
Yep.
on the head, you're working with the pituitary gland as well, which is the master endocrine gland. So as you strengthen that, it builds energy in the rest of the body for healing.
So when you're working the cranial system, you're working on your pituitary gland.
You're working on the pituitary.
Okay.
That releases the other hormones for the rest of the of the endocrine organs.
That's interesting. So is that something that you would work on, let's say, if somebody was having some sort of growth hormone deficit? Because I know that's
You
related to
could.
the pituitary gland.
You could, yes. And
Okay.
I've seen cases of that where you can work on children.
Yeah.
And if the pituitary gland is stuck, perhaps from a difficult labor and delivery, or if they had a bad head injury, you might be able to stimulate some growth that way.
Oh, you mean, so let's say a teenager at like 14 or 15 years old, it could have been from a birth trauma? If they're not
Perhaps
growing?
some things, yeah. That tends to be more of a congenital thing,
Okay.
where the pituitary might be missing some of the cells that produce the growth hormone.
Okay, I'm wondering, because I know we have a table here, can we do a little demonstration and then can you talk us
Absolutely.
through what you're doing?
Sure.
So I'm going to be your guinea pig.
I'd be happy to.
All right, so let me make sure I get myself adequately over here without doing any damage. Okay. So I should take off my glasses, right?
Sure, yeah. Get
Okay.
yourself nice and relaxed there.
Okay.
So you said you were having some stuffiness in the sinuses?
Oh, yeah. So before we got on the air, so I'm allergic to mold, and normally this time of year I get a little congested. My breath work and yoga and meditation has helped, but this weekend I was down in my basement cleaning out my basement. So I kind of have a double whammy, so I'm a little congested.
Yeah. So the mold is, something that's really common.
A mold allergy is common.
Yeah. And most of Connecticut are wetlands, so unfortunately, a lot of us have this chronic mold exposure that's all year long. And then worse when the weather is damp, so. So, the technique that I'm doing now, do you want me to explain it a little bit? Or?
Yeah, that'd
Sure.
be great.
I'm doing a technique called venous sinus drainage, and it's just kind of a basic, systematic type of a cranial technique where I'm going to help to drain the. There are these little blood-filled sinuses in the base of the skull that we tend to get a lot of, fluid congestion in, and when you open them up, it helps to, drain the circulation so that there's better flow, there's less inflammation. It'll help to drain the air sinuses.
So am I going to need a tissue, like, immediately?
Probably not immediately. Maybe a few
Do you have
minutes
5
after.
minutes?
Maybe a few minutes after. But it'll help the airways to open up. And the nose, and it'll also open up that area we were talking about at the base of the skull.
Now, what kind of functions, you mentioned some things around the base of the skull. I mean, it seems like such a critical area for so many things.
It's such a small area where so many things pass through besides the spinal column. There's the vagus nerve, that's controlling digestion, swallowing function, acid reflux. So as you work the nerves at their origin and free them up, I work a lot with, like, for instance, the GI system.
Okay.
Children with reflux and spitting up, and infants who are having trouble with breastfeeding, all those little nerves can get, constricted and congested to a small degree. Not a major compression. We're talking about, micro compressions.
So you work with infants.
I do. I work with infants. You can work with newborns. Just gently bring the soft parts of the skull back into alignment. And they do really well with the treatments.
Well, I know there's been a lot written lately around just even trauma at birth, even if it's a normal birth, just kind of with the head and neck navigating the birth canal. Is that, so do you have to do like adjustments on newborns? Or?
Well, it's more, everything is more fluid when kids are newborn. So that occiput bone in the back of the skull where the spinal column comes out, kind of where I'm working right now, it's in 4 parts at birth. So it's soft, it's more cartilage, and then as children get closer towards 2 years, it begins to form into bone. So if kids are born with a funny shaped head, a cone head, any kind of developmental delays, autism, allergies, if the neck is twisted to one side, that's called a term called torticollis. You can gently realign the base of the skull, the occiput, to help with that. A common type of congestion that kids get are the chronic ear infections.
Yeah.
And a lot of times that's related to the eustachian tube. That's like a tube that kind of equalizes pressure between the middle ear and the back of the throat. But that's more straight in little kids, and in adults, as we age, it gets to be more of an angle, so it drains better. So kids are more prone to ear infections because of that. So you can gently align the bones and release the eustachian tube and help those chronic ear infections to clear up. So now I'm just draining the top part of the sinus. It's called the sagittal sinus.
Okay.
It just kind of runs right underneath the suture, but
It's actually very relaxing.
yeah, it is.
fall asleep.
It is relaxing. I've had a
I'm
lot
like,
of my
wow,
patients
that's
fall
great.
asleep, and they're very gentle techniques. That's
Susan, 5 minutes.
Okay.
That's one of the nice things about osteopathy. It's very gentle. Well, there are those thrusting type techniques that can be done. I tend to focus more on the gentle treatments of the cranial system. But they're very precise, so you really have to understand the anatomy like a road map and just allow it to kind of guide you.
So just for our viewers, so what you're doing right now is you're applying pressure on certain points.
Right, I'm actually gapping the suture on both sides.
And what does that mean? Kind of where my...
Yeah, I'm just
The suture
basically pulling it apart
Oh, okay.
with a guided, I'm just moving up towards the front of your skull and just gently prying apart where the suture is, and that helps to create movement.
Give it the 3 minutes.
It helps to create more movement through the and drainage in the areas. I'm just going to finish up with this front part here. This should help to open up the sinuses above the eyes here. Just check one more spot here, then we'll be done. How are you doing?
I'm doing great. I'm
Good.
feeling a little less congested and very relaxed right now.
Good. Yeah, things were a little tight back here, which certainly will predispose to the congestion you were feeling.
3-minute mark, Susan.
Yeah, I did a lot of heavy lifting this weekend, so that could probably have tightened up muscles up there, I guess.
Absolutely, yeah. And this part is called this is just kind of called a base spread, where you kind of releasing the occiput and the temporal bones to open up that first vertebrae, and just kind of pulling back towards me. I'm doing about five things at once, so there we go. Okay. So that was just some basic technique to kind of open up and help those areas to drain a little bit more.
Wow. I definitely feel much.
A little more
Yeah, I
relaxed.
do.
Very
That's
good.
great. Wow, I got to get myself back in gear here. Here we go.
There
Thanks.
we go. Sure.
Okay. Thank you. That's great.
You're
so
welcome.
That didn't take very long at all.
No, and that was
To
a fairly straightforward, simple technique to
I'm
do.
like all relaxed.
In
Now
osteopathy.
I got to get back with the interview. But so that didn't take long at all to have an effect.
Yeah, it was just a couple of minutes, but I was really precise with where
Yeah.
I wanted to apply my
Certain-
focus and
Yeah.
the release. And
So is there any occupational hazard when you're, using your hands a lot with pressure points?
my hands have gotten stronger.
Yeah, I bet.
The only time you wouldn't want to do a cranial treatment is right after someone's had a stroke.
Oh, okay.
And, it's really important to treat someone like after a head injury. Like, for instance, this winter we had a lot of ice, a lot of people were slipping, hitting their tailbone, hitting the back of the head. That's almost like a direct shock to the body's nervous system.
Okay.
So a cranial treatment would be really important to have after that.
So if somebody slips on the ice or
Right.
is doing a lot of heavy shoveling,
Right.
they shouldn't just sort of dismiss it or slough it off.
not
They
if
really should.
not if they kind of had the wind knocked out of them or lost their breath.
Okay.
You know.
So we have about another minute or
Sure.
two, and given that some people these days either don't have health insurance and or maybe are watching their copay dollars, right?
Yes. Those copays just keep going up and up.
I know. So let's talk about when it's necessary to make sure that you get to a practitioner. I mean, you're giving one example of the ice. Is there one or two things that you consider to be staples that people could do for themselves to stay in good health, and or when do they need to make sure that they get in to see somebody?
I mean, definitely you want to get in to see an osteopath after any kind of an injury, whether it's a car accident, a slip on the ice, even newborns after they're born.
Okay.
Kids with chronic ear infections. Sometimes before you try tubes, you might want to try an osteopathic treatment because you can help the ears to drain from the simple techniques,
Okay.
non-invasive techniques that you do. Even with this chronic pain or musculoskeletal conditions that just aren't responding to typical therapies,
Okay.
just to stimulate healing in the body.
Okay, that's great.
So-
And then you gave us some great exercises that people can do just to try to stay healthy.
Definitely.
Okay. Thank you so much for coming on the show.
You're very welcome. It's my pleasure.
Okay, great. I'm Susan Shaner. Until next time with Community Forum, thank you for joining us.